Welcome to the Dream Journal. From the studios of KSQD in Santa Cruz, the Dream Journal is a weekly show where we explore the power of nighttime dreams through conversations with dream experts and with you. Of Carl Jung, who looks outside dreams, who looks inside awakens. Our guest, Dr. Greg Mahr, studies patients with acute trauma, and he discovered that their dreams in the days and weeks after their injury reveal who will fully recover and who will be mired in PTSD months later. I am your host, Catherine Bell of Experiential Dreamwork, and welcome to the Dream Journal. The Dream Journal is also a weekly podcast. Please subscribe, rate, and review, but most importantly, tell your friends. The idea is to get people talking about dreams. So why not tell them about this new podcast you are listening to? You can find archives of the show. We have over 200 shows now in 4.5 years. Archives are available at Apple Podcasts, Spotify, Google, all those good places. You can also find full archives at ksqd.org/the-dream-journal. Greg Mahr is a medical doctor. He's a psychiatrist, a teacher, and a writer. He is director of consultation liaison psychiatry at Henry Ford Hospital in Detroit and is on faculty at the Wayne State University School of Medicine. Dreamwork and Jungian depth psychology have long been standing passions for Greg, and at over 5,000 dreams, he has one of the most extensive collection of personal dreams in the world. This is a topic that's been really fascinating for me for quite some time. I actually met you, Dr. Mahr, or at least I was sitting in your audience in 2022 Tucson IASD conference when you started talking about trauma and dreams. And so we know a lot about, we certainly heard a lot about it. I wouldn't say we know a lot, but we've heard a lot about PTSD, which is a post-traumatic stress disorder, which happens in the months and years after trauma, and which people are, well, let's talk about it. Do you want to tell me what is PTSD? And so just to finish my intro, though, that I met you, heard your talk. I was fascinated by the idea of checking dreams immediately after trauma, because one of the hallmarks of PTSD is sleep disturbance, including nightmares. And so when do the nightmares start? And so you have been looking into this, and you came back to Ashland just a few months ago, and I heard some more reports from your work. And let's talk about PTSD. What is it, and why should we be concerned about it?
Well, PTSD is a very important public health problem. You know, it affects a lot of people. A lot of people have worked with PTSD. I'm kind of working with a more unique population of people with acute stress disorder. Now, PTSD can't be diagnosed till a month after a trauma, but I'm working with patients who've acutely had a trauma. So PTSD is more of a chronic thing that begins a month after trauma, and sometimes many years, and people have very chronic symptoms. So it's interesting and important, I think, to try to understand what happens to people after an acute stress, and how and why and who gets PTSD, and how do you distinguish, how can you predict that, and can early interventions help?
Right. Well, PTSD is incredibly disruptive. It can totally change the personality of people, or creates so much stress in them. And also, it's also highly associated with suicidality. And I want to bring that in, and that veterans and other trauma survivors are very prone to killing themselves. And so it's extremely important that we figure out how to work with PTSD and, if possible, prevent it. This is why your work is so valuable, Dr. Mahr.
Yes, one of the interesting things we've found as we're doing some of the early analysis of our data is that people who have nightmares early on after stress are more likely to have suicidal thoughts a month later. So that it does seem that those early nightmares potentially are predictors, at least of suicidal thoughts. We don't know if they're predictors of actual suicides or not, but thoughts are a risk factor for actual events.
Right. Absolutely. So let's talk a little bit about you. That you work at this trauma center in Detroit, and I understand that's called Understanding Nightmares After Traumatic Experience in Detroit. This united program that you are head of, right? You are part of. You have founded.
Yeah, it's a team approach. We work with the acute surgery department because there's a lot of acute trauma, many of various kinds. Assaults are one of the more common reasons. Also, motor vehicle accidents are another common kind of trauma. Those two types of trauma are most of the cases we see. Mm-hmm. So it's kind of a collaborative work between the trauma surgeons, who are very supportive of our work, and a psychologist, Dr. Mahr, who works closely with the trauma surgery service, myself, and two psychologists from the sleep research program at Henry Ford, who are experts on sleep research and nightmare research and things like that. So they're more the academicians, and Dr. Mahr and I are more the clinicians in the team. Mm-hmm. But it's an exciting collaboration. And it's also important to, besides predicting PTSD, it's also important to do all we can to relieve distress in these situations. These kind of traumatic events are actually surprisingly and sadly very common.
Yes, they are.
And they cause they're often life-changing experiences and distressing experiences. And some people recover very well, and others have a really hard time and struggle. And I think it's important to try to relieve that stress as much as possible, as well try to understand who struggles and why and how we can help.
Well, there's a whole thing about that, about who gets PTSD and who doesn't, because many people do undergo traumatic experiences and they don't end up with PTSD. Do you know what the statistics on that are?
The numbers of people who develop PTSD after an acute stressor are not as high as you'd imagine. They're more like 30%.
Ooh, that's still pretty high, though.
It's complex because it depends on the kind of trauma. Some kinds of traumas are more prone to development of PTSD. For instance, if you have the same degree of injury from an assault by your significant other versus a motor vehicle accident, you're much more likely to have PTSD from the assault just because of the emotional implications. And also people that are some people are more vulnerable because of prior trauma. Yeah. Our population was just a very, urban kind of population. We were surprised ourselves, even though these are the folks we work with all the time. We were still surprised when we asked them the degree of trauma they're exposed to. More than a quarter have heard gunshots in the 3 months prior to their acute trauma. Another quarter were involved in a physical fight in those 3 months prior to their acute trauma. So those populations with pre-existing traumas are at higher risk also.
Right. Right. So that makes it really clear that people from urban populations with less money, more in poverty, are more prone to PTSD because they're in situations where they're likely to be traumatized, maybe in abusive homes, which could happen at any level of income. But abusive homes, is what I've heard, is something that predisposes someone to PTSD.
Yes, those kind of early traumas
Yeah.
are important too. But any kind of trend, and our urban areas are dangerous places where a lot of things happen.
Yes.
So,
Yes, it's very, very true. And so, so you get to talk to people who have undergone something very recent. And why don't you tell us a little bit about what your protocol is? I take it you talk to these people, ask if they're willing to participate, and then you talk about the nightmares or dreams in general. What does that
yeah,
look like?
yes, we talk to people immediately after a trauma. They're the more serious traumas because they're the people that get admitted to the hospital.
Right.
So they're more serious traumas automatically.
Yeah.
And we ask them if, in addition to the usual supportive care and therapy that we would offer them, if they would be interested in participating in this study, which involves filling out. I mean, we're very grateful to our patients, actually, because we ask them to fill out questionnaires for about an hour early on, and then for another hour when they come back 2 weeks later, and again when they come back in a month. And we, for that we offer them a very, very tiny kind of symbolic amount of money, but they're, very eager to participate.
Yeah.
One thing that's been interesting too, and was surprising to some of my basic science colleagues, who kind of assumed that people wouldn't want to talk about their dreams and nightmares, but to their surprise, patients were actually very eager to talk about their nightmares, even their scary dreams, and seemed happy and grateful that someone was asking about them and talking about them.
Wow, I'm just going to stop right there. There's something very powerful about that, and that people, I might assume someone didn't want to talk about a dream or didn't want to talk about their trauma. Now, you're specifically asking them about dreams, and that's what
Yes,
they talk
we
about.
asked them specifically if just to tell us, would they be interested in telling us any dreams they have, and we give them a mechanism for recording the dreams, so they don't have to write them down. They can send us a little audio file.
Mm-hmm. So but that they're eager to talk about them is interesting. Like there is something here that's helpful in going into the dreams right away. I know many people, and certainly myself, I've woken up with nightmares going, I'm not going to look at that one, right? I don't want to talk about that. But when I do take the courage, really, and take the step of writing it down and considering mentioning it to somebody, it's always fruitful.
Yes, and when you think about the dream process and the potential purpose of dreams, I mean, a nightmare is waking us up often. It's often literally waking us up and sort of symbolically waking us up in the sense of wanting to tell us something. So people not only want to talk about their nightmares, but almost feel kind of compelled to talk about them because I think they want to understand them. I think it's also important and interesting that we assume people don't want to talk about them.
Yeah.
I think there's kind of a cultural bias sometimes against dreams, and kind of maybe even in a broader sense against looking inward at ourselves. So because we don't want to do that, we kind of assume that nobody wants to do that.
Well, the thing is, there's a difference between doesn't want to and doesn't benefit from. I mean, like I might not want to talk about that nightmare, and yet whenever I do bring it up, it's beneficial. I'm so glad I did in the right environment with the right people. And now I know you were not specifically involved in therapy around the dreams with your clients, they weren't even clients really, with the people in the study. That's right? It wasn't really a therapeutic thing, or was there an aspect of that?
That's not exactly true. The treatment wasn't part of the study.
Yeah.
But they're being seen supportively just as part of their medical and surgical care. So we do, especially Dr. Moore, we do spend quite a bit of time with people trying to work with them and help them process the trauma and develop. Part of the processing, I think, is developing a narrative or story that helps the trauma fit into their lives, because these people are in the typical situation where they were just going about their ordinary lives and in no way expecting anything to happen, and then something very tragic happens that in an instant changes their lives.
Yes.
And how do you fit that in? So they do get a lot of therapy, both support and accepting their feelings and being honest with them, because sometimes sometimes families and even caregivers want to almost like minimize the trauma. They want to make it like, well, everything's going to go back to normal.
Right.
No, that's not going to. They're there. They know that's not quite right, and they don't want to hear that. They want someone to talk to them straight about this is a big life-changing event, and they have to process it.
Right. Well, there's some. I want to go, but what you said there, I just want to highlight that developing a narrative to help the trauma fit into their lives, and that dreams really seem to help with that. I mean, dreams are narratives. That is what they are.
They're little mini stories.
They are.
They're mini narratives.
So let's talk about the dreams themselves. I know that one of the hallmarks of a long-term PTSD is replicative nightmares, where the nightmare is the traumatic event, like almost blow for blow. And that's, certainly very common in the long-term situation with PTSD. And what did you find after the acute trauma, when it's much closer to the event? Were there people who had the replicative nightmares right away? Did everybody have the replicative nightmares, or did people sort themselves out into people who were processing it and doing well versus people who are not doing so well with their trauma? I imagine there's a whole continuum, of course, but
yeah, no, it's an interesting and complex question.
Yeah.
And it's even interesting when you start thinking in more detail about what does trauma replicative really mean.
Yeah.
What we've been finding, which a lot of other researchers find too, is that trauma replicative, yes, but up to a point. It's usually trauma replicative, except for some really important details, like what we find on occasion, which is very interesting, is that it's trauma replicative, but with a different ending, like a happier ending where the person takes control of the situation and prevents something from happening. So it's almost, I mean, this is speculative, but it's almost like they're beginning to process the trauma by sort of changing its outcome, not in a way of avoiding the pain or denying it, but in a way of processing it, and what they especially seem to want to or have the need to change is the helplessness that occurs in the trauma. Because there's this sudden, one thing that you realize when you talk to these patients a lot, there's like a sudden moment where their whole view of the world changes. Actually, I just wanted to share this quote. Many of you are probably familiar with the painter Frida Kahlo.
Yes. Love her work.
But she had an important trauma early in her life where she was kind of in a tram bus accident, and she had a large piece of metal driven through her pelvis and so forth. But the way she described it when she wrote about it was very interesting. And this is a quote from her. She said, if you knew how terrible it is to know suddenly, as if a bolt of lightning elucidated the earth. Now I live in a painful planet, transparent as ice, but it is as if I had learned everything in a few seconds.
Wow.
But to me, that's like really powerful. It's very reminiscent of the way these folks talk about it. Like they suddenly see that anything can happen. So our lives are fragile, and our plans are fragile, and that's you can respond to that insight in a couple of ways. You can say, "Oh my God, everything is fragile. There's no point in doing anything," or you can respond that everything's fragile, but that's a gift, and it's a gift that I'm here, and a gift that I can live my life and so forth. So there's different ways of responding to that powerful insight.
Yeah, now I live in a painful planet. I want to talk about helplessness. Like, this is something that I understand having to do with helplessness during the trauma itself and also during the dreams. What do you want to say? Tell us about helplessness.
Yeah, helplessness, as we're seeing with these patients, is a very important issue because suddenly, I mean, there's nothing you can do about what happened.
Yeah.
And that's a terrible feeling for people. It's almost worse than the self-blame people feel. It's very common for people to like blame themselves, like, oh geez, if I hadn't gone to the grocery store at that moment, if I hadn't, said this to so-and-so, if I had walked out, there's a million what ifs that people put themselves through to kind of blame themselves through. But what we kind of have been realizing the more we talk to these folks is that self-blame is very real, but it also protects against this feeling of helplessness, which is almost even worse. Because it's one thing to blame yourself, but it's another thing to realize that anything can happen and it's entirely out of my control. That's the helplessness that's even more terrifying in some ways than that self-blame.
Ooh, that gives me goosebumps. Like, okay, that sense of helpless, that is a kind of a surrender, like where I really couldn't control what happened. Like, that's even scarier than blaming myself.
Yes.
Wow, okay.
Exactly. And so we're kind of looking at, and we don't have definitive answers yet, but we're looking at, the dreams that have helplessness, and do they predict something about outcome? Because the kinds of psychotherapies that are helpful in treating nightmares directly often involve kind of changing the outcome and giving the dreamer kind of more control over the dream. So because that's what works in the therapies that are helpful.
That's like image replacement therapy, right?
Yes.
Or image rehearsal therapy. Rehearsal therapy.
Yes, image rehearsal therapy, exactly. Exactly.
But it sounds like that's what the dreams are naturally doing, that the dreams are evolved toward a place where there's a better ending. Is that what you're saying?
That's the fascinating part. It's like some people like spontaneously do image rehearsal therapy without anyone showing them or teaching them. It's fascinating.
Right. Okay. And so is there? So this is my mind's going this is a fascinating topic for me. But one thing that keeps coming up is the work of Rosalind Cartwright. Are you familiar with her book, The 24-Hour Mind? She's working in the 90s and early 80s about people who had been divorced and whether they were traumatized or not. And she looked at the dreams of people who recovered from their, not trauma exactly, that word wasn't popular at that time, wasn't used, but people who got out of their depression. And, there were sort of three cohorts of people who were never depressed around their divorce, people who were depressed and got over it, and then people also who were depressed and didn't get over it during the course of the study, which was some cases up to a year. And she traced different dream patterns in those three cohorts, which gave some insight into who would recover and who would not.
Yeah, I am familiar with, I'd forgotten the name, but I am familiar with those results. I know there's data, for instance, that people who dream about their divorce more seem to be doing better after a year or so, have a better recovery from that trauma. So that's very interesting. It actually kind of brings up the bigger, very complicated questions. Are nightmares bad or are they good?
Right.
Are they good? Do they help you process the trauma? Do they make it worse? Because they're like a symptom that is one of the official criteria. There's a kind of a natural inclination to, especially on the part of physicians, to like make them stop, because then you don't cross the checkbox for having PTSD. And maybe that's good, but maybe it's not, because maybe the nightmares are trying to heal it, or it may be just more complicated. It may be a combination of the two. It may be something that's initially good, but then kind of gets out of control, kind of like happens in autoimmune diseases, like the good immune response can get out of control.
Right. I see what you're saying.
Become a problem in its own right.
Yeah. Right. Well, I feel like we're just about to get to the punchline here, but I'm, not that there's any solution here, and I know your work is just indicative; it's not definitive, but it's very helpful, and combining what I understand from your talks and with what I've read with the Strauss and Cartwright work, is that the way the dreamer behaves in the dream is often an indication of whether the dreamer is healing or that they're still stuck.
That makes sense. It seems intuitively correct, and it seems like we have a file of a bunch of these patients' dreams that we're beginning to work with now in a systematic way, and preliminarily that seems like that's true, but I don't want to go out on a limb and say it's true until I can actually say that with conviction, based on data. But it seems like it's probably going to turn out to be true.
Okay, well, this is not a publication. This is just your inner thoughts here, Greg, just between you and me and a couple thousand listeners.
If we're sharing inner thoughts, I think that helplessness in a dream is like really critical, and I think if you help people address that, and that's reflecting a feeling of helplessness that needs to be processed. So I think that's at the center of the whole issue, because that seems to be the painful feeling that's most central to the experiences of these trauma survivors.
Helplessness. And we're talking in particular about nightmares and whether they are predictive of PTSD as well as symptoms of PTSD. We are broadcast live from the KSQD studios in Santa Cruz and co-broadcast live in San Jose by KCXU. This is the Dream Journal. Okay, welcome back to the Dream Journal. Next week, our guest will be Dr. Stephanie Burns, who will be talking about ancestral dreaming. My name is Catherine Bell, and this is the Dream Journal. And my guest today is Dr. Greg Mahr, and the topic is nightmares and acute trauma, and do they have indications for PTSD? So, hello, Greg.
Hello again.
Yes, wonderful. So, I always thought we would maybe just shift a little bit and look at yourself. I want to get back to the personal, the idea of helplessness, but let's talk a little bit about you. You've mentioned that you have a very extensive journal of over 5,000 dreams. How could that be? You must be recording like dreams all day, every day.
Yes, actually, I've been recording dreams of my own personal dreams since, childhood, since I was 10 or so. A few years ago, I actually found a trash bag that I'd been carrying around with me through all of my moves, kind of forgetting what was in it, and I actually went through it. It's a lot of old journals with handwritten dreams from way back when. So it's something I've been interested in for a long time, and has always seemed important and meaningful to me, and kind of mysterious. I think that added to the personal appeal. Like, what is this? This must mean something, but I don't know what it means. So I think that added to the personal kind of appeal.
Yeah. Did you have did you guys talk about dreams in your family, or did you have like early encouragement? How you got so interested in dreams so early?
Well, I can't say that I had early encouragement. My mother had some kind of superstitious ideas about dreams, that if you dreamt of X, they were tended to be kind of sad, negative things. If you dreamt about this, something bad would happen. And she also she worked in a deli when I was young, and it was interesting when the Michigan State Lottery first came out. The lottery tickets were very popular in the deli, and the deli started selling these dream books where, again, if you dream about a gorilla, you should bet number 6712. So those were amazingly popular books. I don't know if they still are or not.
Oh, funny. Okay.
So no, I didn't have any official encouragement.
Oh no, but there was it was in the conversation though. Interesting.
It was in the conversation.
And then as you studied, went to school, and you're a psychiatrist, so you've gone through the full medical school. Did you, at what point did you start to think that you could study dreams professionally?
That's interesting. Can give you a longer answer to that. I think I studied psychiatry. I started reading like Freud and Jung in high school, and I studied psychiatry anticipating that I'd learn a lot more about that kind of thing. But that was around the time where psychiatry had become much more biological and focused on pharmacology and psychotropic medication. So actually I learned very little about psychodynamic stuff professionally. I learned some because I went to a kind of an old school training program, which was very psychoanalytically oriented. But in terms of actual practice, it was never really like encouraged. It was always something I did on the side and was important to me on the side. And I started exploring more later on in my career. I think early in my career I was like eager to please and do the right things.
Like we all?
Later in my life, I just decided to do what actually matters.
Yeah.
Do well.
So it's something you've come to lately to really make a profession of your passion.
Exactly. It's something I decided to make the things that I actually cared about more important professionally, and it's been very interesting because I've kind of have a missionary zeal about that work because I love talking to my my colleagues on the other side, like on the kind of bioscientific side. I love talking to them and about, no, dreams matter. I know they're not measurable. I know you can't do controlled trials, but believe me, they're meaningful.
Okay. Okay. My engineer just handed me a note saying there's an email question from Amy. So he's going to read the question on the air, and we'll see what Amy has to say.
Thank you so much for this episode. Very interesting. I have a two-part question. In general, how would you recommend speaking with your therapist about being open to discussing your dreams during therapy? I'm an active dreamer and have found that therapists are reluctant to focus on dreams. Additionally, I have recurring dreams that my therapist wants to avoid talking about, almost as if talking will give it more significance. But I think they may be important nightmares to understanding past trauma. Thank you.
Okay, Amy, thank you so much for writing in. I really appreciate that question. How do we bring up this topic with doctors? That is a very good question. And what do you think?
Yeah, it's very interesting. Actually, I've done some research about that. I published a book about dreams about a year and a half ago, and that's one thing I explored some in that book. And it's very interesting that...
let's just say the name of your book, since I didn't say it earlier. I'll say it at the end. It's Wisdom of Your Dreams? Wisdom?
It's called The Wisdom of Dreams.
The Wisdom of Dreams.
Science, synchronicity, and the language of the soul.
Okay, thank you.
So one thing I mentioned there, and I kind of reviewed that data, which is really interesting. So it turns out that about 60% of people in therapy will bring their therapist's dreams, even when the therapist doesn't want to hear them, in a sense, even if they're like behaviorally oriented or cognitively behavioral oriented, and that's not really their thing. Patients will still bring them dreams. And I think part of the problem is, as Amy described, therapists sometimes don't know what to do with them, because they're uncomfortable. The itty little bit they know about dreams makes it sound mysterious and some kind of like a occult craft of interpreting dreams and things like that. And it's really, so they don't want to deal with it because they feel inadequate, so they kind of ignore what patients bring them. But the fact that patients, like Amy describes, the fact that patients keep bringing them, like they know intuitively that there's something important there, so they're kind of sending us a message. So in my other hat, when I work with therapists and supervision and things like that, I try to help them feel comfortable working with dreams.
Right.
And part of the reason I wrote the other book was to kind of help therapists with that.
Okay. Right. And so what about for people like Amy who are in a therapeutic relationship and want to actually encourage their doctor to listen to their dreams, their therapist?
I keep after the therapist.
Just keep after them. Okay. This is important to me.
in a kind way, but just kind of say that this seems important. And there's, I think what folks find too is that they sometimes need other avenues to work on their dreams. So you can talk about them with knowledgeable, supportive friends. And like I've had a dream group that I help run for 15 years now, or 10 years or so, and so people sometimes seek the wisdom from the dreams outside of regular therapy. That's okay too. You want to be careful, like interpreting your own dreams, because you can kind of miss things and overinterpret things, and I wouldn't even think of it as interpreting. I think of it as exploring, because there's no like one set meaning. Right. But I think keep bringing them to your therapist in a kind way. Perhaps find an avenue outside of therapy where you can explore those dreams, and even simply reading about them and coming and reading about dream imagery and so forth can be very helpful.
Right, and any kind of art around dreams is wonderful as well. But I think this is great, and I hope people like Amy continue to bring their dreams to their therapist to let the establishment to let more and more people know that these are meaningful. But they're like symptoms. They're like, I have a rash on my arm. Like, what it could be caused by, many different things. It's, there may be something psychosomatic, there may be something external, but I know this may be a bad example, but dreams have a variety of levels of exploration, but they are in some ways a symptom of what's going on for the person. I guess that's what I'm mulling over here, is that for me, a dream is like a sign of something going on inside of myself, and I may not understand. In fact, I usually don't understand my own dream.
There's sort of two aspects of that, and that's a very interesting question. There's one, dreams can be symptoms in that sense, and certainly dreams are symptoms in trauma. For instance, like half of patients develop nightmares, so they're clearly a symptom in that they're sort of a representation of what's happened to the body. So that's one way, which is true, but there's also a deeper way. Unlike symptoms like rashes, there's symptoms with meaning. So they're symptoms, but they're also, I think at least, partially messages from your deeper psyche.
Yeah. Okay.
Giving you advice or thoughts about how to heal or pathways that you may not understand. So they're symptoms, yes, but also messages.
Yeah. Right. Well, symptoms are messages too. It's interesting that
Well, that's true.
Thinking of like symptoms of the psyche, what's happening in the psyche into our deeper self. And I realized I never did my dream share today. I usually start out with a dream share, but I was a little distracted, and just I'd like to share a little dream with you, Greg, if I may.
Oh, please.
Yeah, I just had this dream a couple nights ago and I don't remember most of it, but what I do remember is I'm sitting on the steps of a chapel. It's a particular chapel close to where I grew up, and there's a man sitting with me, and we're talking about something deep and important and philosophical. It's intimate, but it's not very personal. It's like the meaning of life or something. But there's like this poignancy, this sense of poignancy. And so I shared this with one of my dream groups this week, and I don't know what it is, of course, but as I was talking about it out loud and someone was sharing their reflections, I had this sudden, well, I guess I'm going to share it now. Oh, darn. But it's really tender, because I had this sudden image that inside the chapel was my father, because my father is declining, and he's 90, and he's in the hospital, and I'm just really scared about what's happening to him, and like to be sitting outside. I'm just very, very emotional about that there's some way that talking with this man is helpful, and it's also kind of shielding me for the sadness that I'm feeling, and kind of getting ready for the grief. Whether it's the next week or 2-3 years from now, I don't know. But the grief of losing my father.
Yeah, was he the person you were talking to in the dream?
No, it was somebody I didn't know. I don't really have a very good image of the person, but just somebody simpatico, somebody I could really relate to, who could relate to me.
Yeah.
Sharing our ideas and our passions and meanings.
Yeah, no, that is a very powerful dream, and the setting is really amazing. On the steps of a chapel, which is automatically gives it a sacred quality. And I always love dreams with these wise old man figures, and it's often they often say something or write something down that you can't quite remember or read, because I think that would be too easy. But,
right.
Yeah, but someone should look at dreams of the elderly. My father, who doesn't, as long as we're sharing dreams, my father, who doesn't usually share dreams, a few weeks ago, he told me, I had this dream that I was building a bridge, and some people were telling me that not to build it, that it's too expensive, and so forth. The dreams he shares, he sometimes has these negative voices, but I thought, without doing a big, interpretation or ceremony about it, I just kind of told him very concretely, ignore those people, keep building that bridge. I think he could hear. I think he could hear that. I mean, he's 102, so he's not all with it, but he's still with it enough to understand. But that's what I mean about the messages. There are symptoms, but also something more.
Yeah. Yep.
That's a really good example of that, actually.
Right. And both of those dreams have this sense of a meaningfulness and a deep feeling, and it's that for me is the value. Like, it's kind of bringing up for me the feelings that I know, of course, I'm sad that my father's declining, but that I can connect with it on a deeper level from touching into this dream. And maybe your father's building a bridge. Who knows where that bridge goes to? I don't know. Yeah,
and I think dreams always tell us that something more than we're conscious of. So if I could go out on a limb and make a comment about your dream, I think it's more than just your feeling sad about his state, which is certainly there and true, but you're aware of that. But I think there's a deeper message that there can be a wisdom that you can get perhaps still from him or from your experiences with him. I think that's embedded in that dream as well.
Right. Oh, I like that. Yeah, thank you. That is that's beautiful. Right. And so that's like the messages idea, that the messages, that there are messages. There is meaningfulness.
Yeah.
The meaning is there's meaningfulness.
Yeah. And one kind of a story I tell in the book, which is really true when I talk to people about dreams. One common reaction is people say, "Oh yeah, that's kind of interesting, but aren't dreams just nonsense?"
Right.
And then it's like they're following a script. They always say, "For example, last night I had this dream."
Yes. I hear that.
And it's always this absolutely transparent dream.
Right. But not to them, not to the dreamer.
Yeah, not to them, no.
Yeah.
But that's a good example of what I meant about sometimes you can miss things about yourself.
Yeah. Right. And so interesting, going back to your idea of some of the purpose of dreams to some degree, and I've talked about this with Mark Blagrove too, his purpose is to talk about them and to bring up what the issues, whatever it is, or the feeling of the dream, because you don't always know what the issue is behind the dream, but certainly there's a feeling there.
Right. There's sometimes especially real powerful dreams that people call big dreams. They also almost like compel the person to talk about them. Yeah.
Right, and make that story the narrative of the life, which we talked about earlier as well.
Yes.
So Greg Mahr, we're near the end of our time together. The hour always goes so fast. I wonder, why don't you share some contact info, a web page maybe, and then we'll have time for final thoughts.
Okay. Yeah. I do have a web page kind of focused on that book that I published about a year ago. That's called thewisdomofdreamsbook.com. The book is on Amazon. It was published by Routledge, Routledge, which is a major academic publisher that I'm very proud of. That they took my book.
Congratulations. Right.
Yeah,
and so people can contact you through that webpage? There's a contact page? Okay.
Yes.
Yes, congratulations on that book. And the book talks about clinical approaches as well as personal approaches?
It tells a little bit about my own personal journey to dreams, as well as I think the fun thing I did is I worked with Chris Drake, who's a sleep scientist, so it's kind of trying to meld the science part and the interpretive part. And one thing that kind of made it fun was I started each chapter with a dream and ended it with like a discussion or exploration of that dream, so that it almost seemed like the dreams kind of wrote the chapters. Like once I found the right dream, then the whole chapter fell together.
Nice.
So that was an exciting process.
Oh, that's very. I love that. I look forward to checking that out. And so, what about final thoughts of encouragement? Is there anything for our listeners that you want to leave us with?
Yeah, I say we tend to focus on the negatives of trauma, and I don't want to minimize them because those are very crucial and very important, and it's really important to acknowledge the pain and the emotional suffering as well as physical pain that people go through. But at the same time, there's a lot of interesting discussion in the literature now about traumatic growth and how people change. Even the Frida Kahlo story that I mentioned earlier, her terrible accident was part of what made her decide to become a painter, for instance.
Right. Okay.
So there's that concept of post-traumatic growth, and the other tips because traumas like motor vehicle accidents and assaults are sadly very common, and it's important to. I think families sometimes try to minimize the trauma and tell people, "Oh, it's going to be okay, it's going to be fine," and don't sort of discourage people from doing that, but more approach it from a point of view of acknowledging that they're acknowledging the pain, and that's because it's okay to feel that, just like it's okay to talk about nightmares. We can't always. I think we like to pretend that life is always wonderful and it's supposed to be that way. It's not. It's never that way, and we have to face the darker aspects of it too, and honestly and with authenticity.
Yeah. Thank you. Thank you. Dr. Greg Mahr, it was a pleasure for sure. I'd love to stay in touch.
Yes, enjoyed the conversation. Thank you.
Excellent. Okay. Bye.
Bye-bye.
All right. Thank you for listening. The Dream Journal is produced at the studios of KSQD in Santa Cruz. We are live every Saturday morning at 10 a.m. Pacific. You can join the conversation at ksqd.org. The podcast is released on the Monday after the show. Keeps us growing when you subscribe, rate, and review. I am Catherine Bell. You can find out about my dream coaching practice at experientialdreamwork.com. Email me at catherine@ksqd.org, KATHERINE@ksqd.org. You can follow Experiential Dreamwork on Facebook and Instagram to find out about upcoming shows. I'd like to thank Rick Leffel, engineer and music creator, Tony Russamano, Eva Milady. The intro music is Water Over Stones, and this outro music you're listening to right now is Everything, both by Mood Science. And tomorrow morning when you wake up, take a minute to write down your dream and bring it to the next Dream Journal.